All right, good morning, Carbon County. Thank you for joining us for this morning's panel discussion as we present local providers between MHCC and public health to talk about some important information regarding the COVID-19 vaccine. And so with that, we're going to go ahead and get started this morning. This morning's speakers, we have Ken Harmon, CEO for Memorial Hospital of Carbon County. We have Dr. Dwayne Abels, who is retired physician from MHCC, and he is also steers the COVID committee at MHCC. We have Jacqueline Wells with Public Health, Amanda Brown with Public Health, and Christina Ball, also of MHCC, as the infection prevention specialist. So with that, we'll go ahead and start, and Dr. Abels, we'll turn it over to you.
Okay, so apparently, according to the picture on the Rollins Daily Times, I did get an injection of the Moderna vaccine, which is true. And basically, in spite of all this stuff and the fears and everything that's circulating, particularly on the internet, I still have 5 fingers and 5 toes everywhere, okay? I did have a sore arm for 2 days. And it was sorer than the influenza vaccine, but that was it. I did check with my colleagues also who got the injection, and that's all they had. They had no other symptoms. And I did cruise the hospital after the first set and talk to people. And some people did have some mild fatigue for a couple days. Some people did have some mild body aches for 24 hours. Sort of like when we get the flu shot, some people get that. When I've had flu shots, I've had the body aches and low-grade fever occasionally. And low-grade fevers have occurred with this, but that's much lower than just simply having a little bit of achiness and getting through it. But after seeing COVID patients, and several of my family members now have had COVID, a couple are in the hospital now, have been in the hospital, or one in the hospital now. I assure you, this disease is a lot worse than a few aches and pains of getting the vaccine. And once again, the crucial thing is, everywhere I go, when will life get back to normal, especially in the last few months since the vaccines have been released? My statement is very simple. Unless we get 85% minimum of the population vaccinated, we don't get herd immunity, we're not returning to life normal. And believe me, I empathize with people who have lost their jobs because it's horrible. We need to get herd immunity. So the fears about the vaccine not being properly studied is not correct. It has been properly studied. It's gone through all 3 phases. And if you're nervous about the new technology of these 2 vaccines, there are several other vaccines coming down the pipe very shortly that are using older, established type techniques. So there's going to be plenty of opportunity in the next year to get the vaccine. So please get the vaccine. Thank you.
Good morning. My name is Amanda. I'm the nurse manager for public health. And I just wanted to first off say thank you for everyone in the room here, just because we have been working so well together with getting this vaccine campaign rolled out. And each of us play an important role in getting this to everybody in the community. And I just wanted to say thank you for all your guys' help with that. So I just wanted to share a little update about COVID before we go too much into our vaccine plan. So I did have some data that is updated as of this morning. Some of the information from the last 2 weeks is still a little bit behind, but this is the most up-to-date data that we have. So the first one is our EPI curve, and this one is as of yesterday. As you can see, we do follow these more on trends. It's not black and white data, but our EPI curve is going down. So we do like to see that. We do expect a little bit more of an increase over the next 2 weeks after the holidays and a few clusters that we're watching right now, but it is going down. The next one is our 7-day average for Carbon County. So this is a percentage of all of the tests that are done and submitted for Carbon County, how many of those are positive. So as of the week of the 27th, we're at 4%. So that is much lower than we have been seeing over the last several weeks. We also track the same data for 14 days, and this next one is a rolling 14-day average. This one is also going down, so we like to see that downward trend. The next one is a breakdown as of this morning, what our cases look like for Carbon County. So we have a total of 964 cases as of this morning. That is a little bit higher than what the state is reflecting, just because of the few days that it takes for the state to get everything entered into the system. Out of those, we do have about 47 of those that are still pending being confirmed. So they're still on our list that we're tracking, but we haven't confirmed those ones yet. 54 of those have are still active, and we do have 16 deaths for Carbon County. So now we're going to talk about our vaccine plan for Carbon County. So we are continuing to go through phase 1A, and we should be complete with that hopefully by the end of next week. We still have several clinics scheduled for this week and next week, so we're hoping to be through that by the end of next week. The following week, the week of the 18th.
Amanda, why don't we share what 1A means?
Sure.
Because most of the people probably watching do not know that, so why don't you?
Okay, so 1A, brief summary of 1A is mostly frontline healthcare workers. So it is broken down into 17 priority levels, and we have made it most of the way through those. We've worked with all of those 17 levels kind of at the same time, trying to get the most people vaccinated as possible. And we are still finishing up several categories within that. So priority 1, of course, is hospital staff. And then we go down to EMS personnel, long-term care facility, healthcare workers that work at long-term care facilities, public health staff that are administering vaccines, and then we go down to law enforcement, other licensed medical, dental, other people that have direct care with patients. We look at long-term care residents, home health, school nurses, public health laboratory staff, pharmacy staff, and other healthcare facility staff. So that, the simplest form is what 1A looks like. This is published, so if you want to look at this in more detail, the link for that is out there, and we can definitely share that again. And then once we go past that, it starts at 1B, which is, we have not made it to 1B yet. We are still finishing 1A, but we are hoping to be to 1B by the end of next week.
And 1B is effectively continuation of healthcare workers, others that don't necessarily have some of that direct COVID experiences, things like the optometrist or physical therapists and things like that. It also starts to get out into the community, as we'll be dealing with individuals who are over the age of 70. And it's also school teachers and those that are interacting with the students and things like that. There's more categories. Again, you can look at that information. But both the hospital and public health are working very collaboratively on this vaccine. We're the two entities that have applied to the state and to the federal government and have the ability to receive those vaccines. But we're working very, very collaboratively with public health taking the lead. We have been able to vaccinate over 250 people so far.
263.
263. And they're vaccinating more today and more tomorrow, and they're going out to the nursing home in Saratoga early next week. And so we originally received 500 doses of the vaccine that we received on Christmas Eve. It was the present that Carbon County got. You see me smiling and glad is because I see it as the light at the end of the tunnel. This has been a dramatically difficult time for everyone in this community as we've been dealing with COVID and seeing friends and family get the disease and seeing folks we know pass away from this disease. And getting the vaccine gives us the opportunity to have that light at the end of the tunnel. And so on Christmas Eve, we got that for our Christmas present, and we then worked very, very closely together and have started getting through all of those individuals who are in that category 1A. We're working right now on finalizing some of the plans for 1B, but the intent is to get that out. The government then has Category 1C to follow, which will probably be sometime in February. And then beyond that, what the hope is to then being able to have it available to the general public, although that's probably what, in March or April, depends on when we get the vaccines in. We got the 500 doses for our Christmas present for Carbon County, and we've had a couple of additional shipments come in. We had a shipment of 100 and we had a shipment of 200. And so we're going through and aggressively and appropriately using these vaccines and being very careful to make sure that we don't waste any doses. I've read nationally of some folks that aren't quite as careful as we're being. We are proud to say that we have not wasted any doses, that we have been very careful in making sure that we're doing it. We've had no significant complications for any of the 263 people who've gotten the vaccines here. We've had expected side effects that have occurred. I, like Dr. Abels, had a sore arm for about 18 to 20 hours. I took 2 Advil and I was fine. As we visited with all of the employees in the hospital, other than some body aches and some fever and a little nauseousness with a few people, really no significant side effects. We talk about the impact of COVID. COVID is a terrible disease that's impacted a lot of people. Getting the vaccination is a minor little blip to help us get past this. And so the vaccinations are going to be occurring. We'll be reaching out. Public Health will be reaching out in the coming weeks as we tell you when we can start getting that group that are over 70 their shots. But we're excited to see the light at the end of the tunnel.
I must also commend Public Health as well as the hospital getting these vaccines out. When I was reading the stats in most states about how many actual vaccines have been delivered and then when they get them actually administered, our percentage is much better than the vast majority of states in this county. So they've done a wonderful job getting this done. In spite of the holidays, think of the percentage they got out already, and they're going to continue to roll this out, and we can hopefully get more vaccines, but that's under the control of other people, not us.
So I did want to share that we are working with our local partners within Carbon County to get the vaccine to these, once we get to 1B, to the population over the age of 70. So we are working with the senior center, and we plan to host clinics at every senior center throughout Carbon County to help make it easier for people that are over the age of 70 to get the vaccine. So we tentatively plan to start that the week of the 25th of January. So that is tentative based on how quickly we get through 1A and the first priority of 1B and how much vaccine we have at that time. So of course it's very slow getting it out there based on a few factors, but that is the tentative plan. If that changes and when we get close to that, more information will be shared in multiple ways. So everybody will know when it's time, what to do, and then I'll have Jackie kind of get a little bit more information about how to prepare for that vaccine.
Sure. So this morning I put out a release stating some things that you can do to prepare. One of the things is, sorry guys. One of the things you can do is print off and fill out the vaccination form and have it ready for you when you come to the vaccination clinic. And we are going to have that on the Carbon County Public Health website, but as well as a link that I shared out earlier. Bring the completed form, give it to the administrative staff, and they will assist you on where to go from there. We ask that you bring your insurance card if you have one. That's just going to help cover administrative costs only. If you do not have insurance or you don't feel like your insurance will cover it, don't worry. The vaccine is free of charge to any individual regardless of their insurance coverage. When you do come to the vaccine clinic, make sure to wear your face covering and try to maintain that 6-foot social distancing. We will ask you after you've received the vaccine to sit and wait for 15 minutes so we can watch and monitor you for any adverse effects. Participants should not come to the clinic if they're having any form of illness. If they're sick, have a fever, or they're having respiratory symptoms, please stay home. And definitely if you've been diagnosed with COVID-19 in the past 2 weeks. You should wear clothes that are easily accessible to get to your arm. It does make our job a lot easier if we can get to your arm quickly. And it's more efficient for the vaccine. We do not recommend you take any form of NSAIDs, any Tylenol or Benadryl before you come. If you have a reaction afterwards, like a sore arm or a mild allergic reaction, you are welcome to take those things. And then, as Amanda mentioned, we will be putting out a lot of information over the next couple of weeks on where to go, and places and locations and times. So watch out for that, and we will try to get that to all media sources. We have plans to do our Facebook page, which is the Carbon County COVID-19 response page. We also will share that into all the groups, the Rollins News and Chatter, the Saratoga groups, the encampment groups, all of those. Bigfoot 99, Rollins News and Chatter, the Saratoga Sun will all be notified. So hopefully we can get the information out to everybody, as well as when we're working through the senior center, they will help with that correspondence as well. So that's all I have.
So one of the things I want to let people know that I've noticed in the news is after the vaccine, there were a lot of headlines about people got the vaccine and they still had COVID. You have to understand that this is a 2-shot series, regardless right now of which vaccine is out. The completion for immunity of the 95% isn't until 2 weeks after. And Dr. Abels, interrupt me if I'm incorrect. It is until 2 weeks after the second vaccine. So you have some immunity now. I think it's approximately 70% after the first vaccine. And then after your second vaccine, 2 weeks later, you will have the 95% immunity. So please, even if you've had the first vaccine and you're experiencing signs and symptoms of COVID, you still need to isolate and see your provider to be tested, because it can still happen until the series is complete. Now, I'm going to defer to Dr. Abels for all the.
I just wanted to.
No, go ahead.
You did say, but even after the first one, we get to 50 to 70%.
Yes.
Takes 2 weeks also.
Yes, oh, that's right, I'm sorry. And it does take 2 weeks. With most vaccines, once you get them, there is a 2-week period for them to become fully effective. So after the first and the second vaccine, it is 50 to 70%, 2 weeks after the first vaccine and 95% after the second vaccine. So there are also, you can differentiate between symptoms from the vaccine, which should only last 1 to 1.5 days. They have not had any studies where they last longer than that. So if it's a week later and you're experiencing signs of COVID and you think that I'm fine because I have the vaccine, please isolate and see your provider and let that provider decide whether or not, what exactly is going on and whether you need to be tested or not.
Well, again, we'll reiterate, the disease is significant. We are thrilled in Carbon County that folks are trying to continue to be careful. The reason our positivity rate has gone down is because of everyone's efforts to do that. So please continue to do that whether you're getting the vaccine or not. The vaccine is here, is effective, and is safe. At the hospital, we had 2 different days where we gave immunizations to our employees. It was interesting. We had a number of employees who were kind of on the sidelines watching and wanting to see what the reactions really were. They'd heard all of these things on Facebook and saw these things on the internet that weren't true, and they were a little fearful. After the first vaccine, Dr. Abels, myself, and a number of others got our shots. They looked at the complications and the side effects, and they said, this really isn't what the internet says. I had 35 employees who originally said, I'm not sure I'm going to get the vaccine. When they saw how effective it was, and they saw that the complications or known side effects were very minimal, that signed up and actually got it yesterday. And so I think it's important to know the people who know. Some of them were still a little concerned, but they watched and they saw, and they still got the shot now because they found out the side effects really aren't significant, especially compared to the disease. And so we want to encourage everyone in the community, when it comes your time to get the shot, just like Dr. Abel said, we need to step up and get that shot. We need to be able to get to that 85% so we can not have to wear masks. We need to get to that 85% so that we can start having activities like we did prior. The only way we're going to get back to that new normal is by getting that a number of folks in the community to have those vaccinations. Go ahead.
Go ahead, sorry, I didn't mean to interrupt. What I'd like to do is I'd like to ask Dr. Abels to explain, so he mentioned that just briefly earlier, the difference between the old technology and the new technology. I think there's a lot of scare tactics out there regarding the new technology, and I'd like Dr. Abels, even though he's done it before, to briefly explain to you the differences in the technology so that he can maybe
Put those concerns.
yes, thank you, I couldn't think of what I wanted to say. Put those concerns at rest. I think it's important that you hear somebody from our community that we know explain that to us.
So basically, of course, before I got the vaccine, I studied the vaccine because I wanted to know, just because it was published as safe, I wanted to look at the studies. I read the studies, and then I investigated this new technology, how it's designed. Basically, this is an RNA virus that we're fighting. And our old vaccines were live vaccines, attenuated vaccines, like our smallpox vaccine that all the young people have no idea what I'm talking about. And these vaccines had a huge amount of side effects too. Many more side effects than the new vaccines do, actually. So this new technology gives us a messenger RNA, one little strand of genetic material. Not DNA though, so it's not in your nucleus, it's not going to change your DNA. Goes in, it's incorporated into the cell, it does, all messenger RNA goes to your nucleus and is identified and then sent out to what's called a ribosome, which is a manufacturing unit. And that makes a transcription RNA, basically, that sends a message out to the cell to do some proteins, make some proteins. And when these proteins show up on the outside of your cell, your immune system says, wait a minute, that protein does not belong there. I'm going to attack it. The advantage of this particular vaccine and the Pfizer vaccine, in spite of the transportation complications, is that this vaccine attacks the spike protein of the RNA virus. That is the key that allows that virus into your cell. That does not mutate. You know we got a mutation again with this RNA virus. So this new RNA virus is way more contagious, maybe and not as lethal, because RNA or parasites of any kind want to be able to multiply and not kill their host. So this new RNA is becoming more efficient. So this may lead to shutdowns, lockdowns again. We need to avoid that for the sake of our people in this community as well as the nation. And so this is why I felt it was safe, because that RNA is destroyed completely after it's in the cell. within 24 to 48 hours, it is gone. No remnants are left. So as far as altering DNA and all the things I've read on the internet, it's not possible.
Are there any other comments that the group would like to add before we move into some of the questions?
I know that there are a few questions that we've been getting at Public Health. And the first one being, if somebody's already had COVID, is it safe for me to get the vaccine? And it is safe and it is suggested that you get the vaccine. If you fall within the categories that we're working now, you should get the vaccine. The immunity that you get from getting the vaccine will last longer than the immunity you have from actually having the virus. So it is recommended still, as long as you're after that 14-day, you're recovered, definitely still get the vaccine.
And the reason that is recommended by public health and people that are in the know appropriately is that convalescent antibody transfusions, the last 3 studies have failed to improve our patients. Why is that? These are natural antibodies. Because our immune system produces multiple different types of antibodies, and it turned out that the levels of the spike antibody are not that high, and in fact the vaccine will produce 32 times the number of 32 times the antibody of the spike, which is the important antibody.
Perfect. Maybe we take some questions then.
Yeah, we'll go ahead and move into some questions from viewers. And again, for those viewing today, please feel free to continue sending questions. So the first one that we're going to address is, are there specific populations that should not receive the vaccine?
You want to take that one or?
I'll take part of it. We'll jointly do this if that's okay. Basically, the vaccine we have is not approved for under 18 as of yet. The studies are inadequate. Obviously, they are continuing these studies because we want to make sure kids have the opportunity to get the vaccine if it's safe. So that's one group.
And the other group that we've been getting a lot of questions on is women that are pregnant. So my first suggestion is you need to talk to your doctor and make sure that it is right for you, but it needs to be something that you talk to your doctor about. They are saying that they don't have enough information to know 100% that it's safe for pregnant women, but based on the science of how the vaccine works, they do not expect it to have any effect, negative effect on pregnant women.
And the American College of Obstetrics and Gynecology, like Emmer said, strongly recommends, because the disease is so bad with pregnant women, the death rate goes way up compared to the non-pregnant women, and ICU admissions go way up, as well as fetal problems because the mom is so sick. So that's the reason, even though the data is not complete, based on the science, the national organization feels that vaccines should be strongly considered, but of course, talk to your OB-GYN specialist.
Thank you. When you received the initial 500 doses of the vaccine, did that include enough for the second required dose for those that were in phase 1A?
No, so these are all first dose allocations that we've received. We will start receiving the second dose allocations anytime now, and they will be tracked separately. So all the doses we have now are meant for that first dose. We are not expected to hold back any of our doses for that second dose of anyone that we've vaccinated so far. We will get separate doses from the state to support that second dose.
And Moderna company has guaranteed second dose. Before they give for their first dose, they won't ship the first dose until they make sure they got enough for all the second dose.
So at what type of a rate are we expected to see additional vaccines coming into the county?
So what we know right now is just for January, and we should expect to get 200 per week for the month of January. After that, we do not know.
Thank you. All right, there's been a lot of public criticism about the delay between when Carbon County received the vaccine and when administration actually began. Holidays and vacations were cited previously as the cause for the delay. What do you say to those in the community who believe you took too long to start rolling out the vaccine?
I can maybe take that. We got it late on the 24th. And the hospital and public health have been working very closely prior to that and putting together plans. We wanted to make sure that we did this in a safe and effective manner, make sure that we had it set up so that we were not wasting doses. The doses come in vials, and there are 10 doses per vial, although occasionally we can get 11 out of them. When we have those doses, we have to thaw them out and have them, once we've penetrated that vial, we have 6 hours to give those vaccines. If we gave 2 of them and didn't give the other vaccines, we would have wasted 8. And we don't want to do that because honestly, the count that we're getting is still relatively low given the number of people we have in the county. And so we worked very closely, and within just a couple of business days after the receipt of that, in fact, the second business day after we had the vaccine, we started doing the administration of those doses. We then had to work with the partners. And we have these different organizations and group in Category 1A. We have the nursing homes, we have the EMS divisions, and we had to coordinate with them and set up times that worked with their employees and their schedules to get together. And so while we've had, I guess, 14 days since we first got that vaccine, we've only actually had 6 working days to be able to do that, and we have aggressively been administering those vaccines during the time. And so while I understand some people would have preferred us to do vaccinations on Christmas Day and on Sundays and on New Year's Day, the people who are doing the administration, the hospital, the nursing staff at public health, I believe have been doing an absolutely wonderful job of getting out. If you compare us to other states, that first dose, we've got 500 doses. We are already probably about 55% administered. If you look at most other areas and most other places around the country, they're somewhere down around 25%. So we're double what most other places in the country are doing, particularly in the bigger cities. So I think we're doing a great job. You're going to see the rate of administration continuing to increase. Thankfully, we don't have a lot of additional holidays coming up. But the second thing you need to understand is public health and the hospitals still have other key functions that we are required to continue to perform as well. Public health has been continuing to do the management of the folks who are sick. They continue to have to provide education to women who are pregnant. They have to continue to do the sexually transmitted disease work they're doing. The hospital, in fact, over the last couple of weeks, we have been extremely busy. Thankfully, we're seeing the number of COVID patients decrease. This morning, we have 3 patients in the hospital who have COVID that are being treated. And we have to have a focus on taking care of the people that we have. And so it's a balance, but I want to tell you, I'm very proud of the rate that is getting out there. And I think public health and the hospital have done a fantastic job. You know, we're never going to please everyone, and I'm sorry that, you know, maybe you haven't got the shot if you really want it. But we are working through the process that the government has set up for us and told us that we have to do it, and we're doing it absolutely correctly. And so I want to say that that should be an unfounded fear, because in the 6 business days we've had since that, we've done a lot of shots and will continue to do them. So thank you.
I have one additional comment to that. We did have staff out on vacation over the holidays, but all of the staff that were out on vacation also showed up on the first clinic day. They didn't not work. They came to work because we were so excited to get this vaccination into people's arms. So our staff have been scrutinized for being on vacation, but ultimately we did come in and we did do vaccinations. So I'm pretty proud of our staff for stepping up.
Also, I'd like to add that sometimes some of these things do take time to plan. there's a lot of paperwork, there's things that we had to do before we could administer the vaccine. For example, in a nursing home, we had to, different people had to be contacted and consents had to be signed, and that takes time. So we can't just roll in there and start administering a vaccine without going through all of those steps to make sure that everybody has access to that vaccine.
I think it's important to know that, that we are working very hard not to let happen here what have happened in other states who were unprepared. I think we are more apt to want to plan and make sure everything is passed out correctly, done correctly, we're not wasting doses, and everybody gets what they need instead of being in a hurry to get everything out. A lot of states have wasted doses, given doses incorrectly. I agree with Ken and everyone. You should be very proud at the job that the hospital and public health is doing to make sure that it is done right. We still have to consider social distancing. We can't have large crowds, so we can't do a regular, like a flu clinic, maybe public health would do, where everybody gets to come and line up. We're not able to do that. We have to still maintain safety measures and make sure everybody does not make anybody else ill, although you shouldn't be coming if you're ill, but just in case. And making sure that we have the right staff on hand. We make sure we have staff there in case there is any kind of reaction. We have our pharmacist that's available with our medications. There's a lot of planning and setup that goes into this that doesn't usually go into regular immunization clinics. And I think it's hard for people to know all that. So that's one of the reasons why we're doing this, so we can explain everything that goes into that.
All right. If a person is under contact tracing, can they still receive the vaccine?
I guess that question, if they're like under quarantine, things like that.
I'm assuming that's, yes.
That's a good question. I think it kind of depends. So I think that individual should be contacting your office, and we can maybe find a clinic that we can have them come to where they would be able to still maintain social distance, and we can make accommodations for that. But there are many clinics coming over the next few weeks that it would probably be equally okay just to have them wait until they're done with their quarantine.
In fact, if you look at the consent form you're filling out, you're answering, have you had the disease in 14 days? And so if you're reasonably sure that you're going to be positive, I think you probably should wait for that 2 weeks. We want to make sure we talk about making sure that we're using the vaccines in an appropriate fashion. And if there's a legitimate, realistic chance that you're positive, we need to wait so the vaccine can be most effective. So when you're doing contact tracing, I think you'll work with public health and they can make a determination whether you're just being cautious or whether you likely have the disease.
So once we have hit the phase where this is available to the public, if a Wyoming resident is not in Wyoming, can they get the vaccine in another state, or will they have to return back to Wyoming?
So this is a federal vaccine. You can receive it anywhere. So if there's somebody not from Wyoming in Wyoming, we can administer them in the same likewise. So you can get the vaccine anywhere.
But I think part of that is going to be based upon when we have enough vaccine. Because I can tell you, we're going to focus on taking care of those who are in the appropriate categories. And as someone who shows up who isn't a Carbon County resident, we're going to take care of our folks first. But eventually, the hope is that we have enough vaccine to be able to open it to everyone. So timing is going to be a little bit there. And different states are on different things. There in Utah, they started doing a little bit of the 1B vaccinations this week with some of the school teachers. And different states have different people in different categories. So the truth of the matter is sure, but it's going to be based on us taking care of our folks first.
And the thing with Utah is Utah happened to get more vaccines per population than we got. See, it's not equally distributed between states. Sorry, it's a federal decision.
All right, so in previous panels, we've talked a lot about herd immunity. So now that we are at a vaccination stage, how much of our population will have to be vaccinated to become truly effective?
Dr. Abel's answer that, but we'll have you do it again.
85%. Obviously, I would prefer 100%, but obviously some people are not able to get vaccines on a rare occasion. They have other diseases, which we understand. But to really have true herd immunity, we need 85%, especially with a RNA virus like this. All RNA viruses mutate more rapidly than other viruses. And it's just, unless you get everybody immune, these mutations then will appear and spread again.
So we've talked about that Moderna vaccine is currently what we have available to us as Carbon County residents. This comment is stating, I'm assuming you would need to make sure you get the same vaccine. So when it comes time for that second dosage, can you clarify that?
Yes, it is recommended that you get the same vaccine for the first and the second dose. We do expect to eventually get some of the Pfizer vaccine. We don't know when, but we do have that possibly happening in the future. So if that does happen, we will make sure that the people that receive the Moderna will receive the same vaccine for the first and the second dose. If it does happen, if somebody's traveling or something and they don't have access to the same vaccine, it is still okay to get the second vaccine if that's the only option, but it is not recommended, but you will not need to repeat that dose either.
Thank you. And going back to you, Dr. Abels, you spoke earlier about DNA and that the vaccine does not affect DNA. Is there any evidence of long-term effects from the vaccine?
The studies that were done were phase 1, phase 2, phase 3. These vaccine numbers were studied at higher numbers than previous vaccines, for those people that may not know that. And what we've done over the last particularly 20 or 30 years, we've discovered doing proper studies that most long-term type effects show up like in the first 2 months of the studies. So we're well past the 2 months in these studies. So long-term effects are not likely. Can I say it's not going to happen? No. But risk-benefit is in our entire life. If I give you a shot of penicillin, I could kill you because of an anaphylactic reaction. You go into shock. Or I may save you from a heart murmur by giving you and treating your strep throat. It's risk-benefit. Everything I do and have done in medicine is risk-benefit. To me, this disease is so bad and destroyed so many people's lives, and there's been so many excessive deaths around the world, that if there are some long-term effects, just like when I took my first polio vaccine and the sugar cube, I assure you it was not studied, but my mother had one brother on iron lung for a year and another brother permanently crippled from polio. We got in line because we've been fortunate not to have severe disease in our world for many years. People forget. So this is why I took the vaccine, risk-benefit, period.
I think people are afraid of the words emergency authorization. And so, Dr. Abels, don't put your mask back on. So, I think it, and it made me think of that about the polio with the sugar cube, because I got the peak drop in the sugar cube too, right in the Carbon County building now.
We're old.
Yeah, we're old. But I think I would like Dr. Abels to explain and take the fear away from emergency authorization. I think that's what scares people, and I think he's better equipped to answer that, him or Ken, about that.
Perhaps, we shall see.
Uh-huh.
Emergency authorization occurred because the world decided this disease was so rampant that we needed to do aggressive studies. The studies that were done exactly as previous studies were done, where they put billions of dollars in, which has never been done before. They built facilities to manufacture this vaccine quickly instead of waiting 12 to 18 months before the vaccines finally start rolling out in adequate quantities. So the emergency use was mostly to build those facilities. And yes, we could have wasted $50 billion if these vaccines failed. But once again, risk versus benefit. But the studies were done exactly as they're supposed to be done. They are what we call peer reviewed. In other words, people outside the study review the study to make sure it's done properly. Because like the first thing in France that the minister released that hydrochloroquine and Zithromax in France was going to cure everybody, if you actually looked at the data, they had a total of 8 patients. It was never published, it was never peer reviewed, so it was false data. That's called, I guess, fake news. Okay?
Makes sense.
Well, I'll jump in a little bit on this. What the United States government did that was so unique with this is they were willing to purchase and put the money in on the manufacturing. And so we actually had the Pfizer and the Moderna vaccines completed and sitting ready for distribution prior to the studies being completed. And the US government put the money at risk and said, we're going to bet that they will get approved, and we hope they get approved. And thankfully, when the studies came back and were peer reviewed and demonstrated that it in fact was very effective and had very, very low side effects, we were able to then get the approval from the FDA and then ship 2-3 days later. The normal process for the creation of vaccine is they go through and do all of the studies, the exact same studies. The study portion was never changed. Same process they do with any vaccine. But normally when you finish the studies, you then get the approval and then you set up the process to begin doing the manufacturing. And so that usually takes an additional year to 18 months beyond that. We were doing them at the same time. Manufacturing was occurring at the same time that the vaccines were being studied. The risk to the US government was if the studies did not come back effective, all of the doses that had been manufactured would have had to have been destroyed and not used. And the government putting up taxpayers' dollars to pay for that dual process. Study, the same as everything that's always been done, but manufacturing at the same time. That's the magic that's got us the result. And I'm grateful that the federal government was able to do that. This is something that's never been done before. The federal government under President Trump did a wonderful job of facilitating this dual track process to get the vaccinations out for us. So.
All right, so once I've been vaccinated, can I stop wearing a mask?
No, fortunately not. We do expect in the coming weeks and months that some of the guidelines and things will change. Once we get to more of that herd immunity, once we get more people vaccinated, and once we get more data from Wyoming, the changes will be made. As of right now, we do not recommend any changes. Still wear your mask, still follow all the state and local guidelines, and we will eventually be making changes to quarantine recommendations and masking recommendations, but at this time we have not.
And the key to getting rid of your mask, which I am in favor of eventually, is to get vaccinated and get herd immunity. It's actually pretty simple.
Yeah, remember, the vaccine is only 95% effective, and as a result, we need to make sure that we have lots of people so that we can stop the spread of this disease. But I think it will get there.
All right, is there any, at this time, it doesn't appear that we have any other comments that have come in. We're getting close to our hour and finishing up here. Is there any final comments from the group on any particular topic?
Yeah, so we have worked really hard with our community members and our agencies and everybody to get everybody that's in 1A that wants a vaccine covered. But it is possible that we might have missed somebody. So if you are in 1A and nobody's contacted you to set up something, please reach out to our office. We wanna make sure everybody has the opportunity to get the vaccine that wants it before we move to 1B. So if you are an EMT or if you're in any of the fields in 1A, please reach out to me so I can make sure that we can get you scheduled.
Could I ask a question? So, because some people are still hesitant, even though they're health professionals, to getting it, and they're technically 1A, and you've started the 1B, and they decide that they reconsidered that, how would you want them to approach you guys?
So we'll have multiple clinics that we could just invite them to. So anyone that's changed their mind, somebody that wants it, that's in 1A, once we move to 1B, can still get it at any time.
I think I know there's still a lot of people hesitant out there, and I'm hoping that this panel answered some of those questions with the fake news. But I think the best way to do this, and I did tell this to staff and other people outside of the hospital that I knew, do exactly what Dr. Abels did, do what Ken does, do what I do what we do. I think the assumption is that we always take everything always at face value. But instead of reading the fake news and the headlines, find the research. Look at the research, see what it says, and then make your decision. I think because of all the politics in the atmosphere this year, that has played a great part in why people are afraid and unwilling to take the vaccine. And as I've said a million times before, this isn't about politics. This is about being able to get back to normal, which is the main goal that everybody wants. And there's only one way to do that. There was only one way to stop the measles. There was only one way to stop polio. And I think it's difficult in this day and age to remember as far back as Dr. Abels and I do. And not Ken, he's not quite that old yet. But is to remember how sick people were around you, to remember that people died from measles around you, people died from and were permanently crippled from polio. And if you've ever seen an eye or lung machine, it is a horrific machine, but it's all we had back then. So I ask you to do research, the right kind of research. Find the objective peer reviews that Dr. Abels and Ken are speaking about. Why there was emergency authorization. Look at the dual process. See that it wasn't just something that was thrown out. There were reasons why that emergency authorization. This isn't the only drug that's ever received emergency authorization either. There are multiple drugs out there, and you probably didn't know about them because they weren't tied to politics. Either side, it doesn't matter to me. This is about medicine. This is about people not dying. This is about people being able to live in their homes and pay their bills and have jobs again.
Okay. All right, so with that, we're going to go ahead and wrap up today's panel discussion on behalf of Carbon County Public Health, Memorial Hospital of Carbon County, and Carbon County Higher Education. We thank you for tuning in this morning, and we encourage you to share this information. Let's help continue to educate our communities, and we will continue to stay in touch with all of you as the vaccine progresses and we're able to administer more widely and to the public. Thank you again.